Thank you, Mr. President. Mr. President, I want to talk for just a few minutes about our efforts to get control of the health care costs dealing with insurance in America. With me today is one of my colleagues from my office, Ms. Kate Dwyer. The Affordable Care Act has not worked for the American people. I wish it had. I'm disappointed that it didn't. We were promised, upon the passage of the Affordable Care Act, that our lives would be better. Our lives are worse. We were promised, upon passage of the Affordable Care Act, that health insurance would be cheaper and more accessible. It's been neither. As you know, Mr. President, the United States Senate has tried to come up with a health insurance reform effort to replace the Affordable Care Act. We have not been able to do that. But we didn't quit, Mr. President, as you well know. We have started through a number of small but meaningful measures along with the Trump administration to lower the cost of health insurance for the American people. And we've made substantial progress. It's been lost in the noise, but it's real nonetheless. And I want to talk about two such efforts briefly. First, association health plans. As you know, Mr. President, one option that has often been missing from our array of health insurance choices is the ability to get together as a group of people, sometimes across state lines, and buy health insurance. And let me explain what I mean by that. Let's suppose you have a chamber of commerce, as many cities and towns and hamlets do. And those chambers of commerce in my state want to join with chambers of commerce in Mississippi, which would join with chambers of commerce in Arkansas, and pool all of their members and say to a health care provider, here are all these people that want to buy health insurance, give us the best deal you can. Through the economy of scale, we could lower the cost of health insurance. Makes sense. But forever and a day, it hasn't been legal in the United States of America. It now is. In 2017, President Trump issued an executive order directing federal agencies to draft regulations to allow the American people to enjoy the fruits of association health plans. In January of this year, the Department of Labor proposed a rule expanding the scope of groups and individuals eligible for banding together as associations and purchasing coverage through an association health plan. And of course, the rule was finalized on June 21st of this year. It became effective August 20th of 2018. I'm not suggesting, Mr. President, that association health plans are going to solve all the problems of access to insurance and cost of health insurance in America, but they will help, and they will help because the principle underlining association health plans is that they allow the free market to work. So now, if you're a member of a Rotary Club and you want to join with Rotary Clubs in other states even, or in other parts of your state, pool a large group of people together, go to a health insurance provider and say, I've got a lot of potential customers here and I want to buy major medical insurance. What kind of deal will you give me? that will be legal in our country. The second thing that we've done, Mr. President, as you're well aware, because I consider you an expert in health care and in health care insurance, has to do with what we call short-term limited duration health plans. What is a short-term limited duration health plan? Well, let's suppose that I leave my job and I have employer-provided insurance. And I'm not sure what I'm going to do next. I've got some ideas and I've got some prospects, but it'll probably be 6 months before I'll take a new job with a new company that'll provide health insurance. I've got a 6-month gap where I and my family will not have health insurance. That's the purpose of short-term, what we call short-term limited duration health plans. There are plans offered throughout our country where if I'm in between jobs, for example, and I don't have insurance and I don't want to pursue my prior health insurance through COBRA, I can go buy one of these short-term limited duration health plans. It's sort of gap coverage, if you will. The problem, and short-term limited duration health plans have been around for a long time. The problem is that for all practical purposes, the Affordable Care Act made them illegal. Now that's a bit of an overstatement. You could still purchase a short-term limited duration health plan, but for a very, very, very short period of time so that they were rendered ineffective. Now, under changes made, these plans will allow families and individuals to purchase these short-term plans for up to 12 months, and in some cases, for up to 36 months. And that's as a result of a new rule promulgated by the Trump administration, which reverses the Obama-era policy that limited these short-term plans to only 3 months with no option to renew. Why are short-term limited duration health plans important? Why are they helping to contribute to our efforts to lower the cost of health insurance? Well, first, let's put that on the other one up, Kate. Here's the problem we're trying to solve, Mr. President, as you well know. These are the increases in premiums, the cost you pay to purchase health insurance through the Affordable Care Act. The Silver Plan from 2017 to 2018. Texas, price went up 41.3% to buy a Silver Plan through the Affordable Care Act. In my state, Louisiana, 12.9%. Oregon, 31.9%. Wisconsin, 43.5%. Pennsylvania, 30.6%. And I could go on and on and on. That's why I say the Affordable Care Act hasn't worked. No one can afford it. I wish it had worked. It gives me no pleasure to say that. But we were told health insurance premiums would go down. They've gone up. By making these short-term limited duration health plans available for a longer period of time, we're giving people the flexibility to extend them. The Trump administration, in my judgment, is making sure that American families have access to a reliable, affordable health care option. Now, we had a vote yesterday. Some of my friends on the Democratic side of the aisle decided they wanted to end short-term limited duration health plans. And they promulgated a proposal through the Congressional Review Act to end them. Fortunately, we defeated that effort. What has been the effect? Well, in terms of price and availability, well, short-term limited duration health plans in many cases are 50 to 80% cheaper than plans purchased under the Affordable Care Act. Now you say, why is that? Well, there's no free lunch, and you're not going to get one now. If you purchase a short-term, limited-duration health plan, it oftentimes does not have the same coverage that you're required to offer if you're a health insurance company offering health insurance under the Affordable Care Act. You're not. You don't get the same coverage. But that doesn't mean you get no coverage, and that doesn't mean that the short-term, limited-duration plan is junk insurance, because it's not. It's considered major medical insurance. And issues like lifetime limits, annual limits, coverage of pre-existing conditions, there are a variety of plans out there offered. If you want to purchase a plan, still cheaper than you could buy under Obamacare, that covers pre-existing conditions, you can. So this idea that short-term, limited-duration health plans are really no insurance at all, or so-called junk insurance, is simply a bunch of nonsense. I'll give you an example, Mr. President. In the last quarter, why don't we put that other? In the last quarter of 2016, our short-term, limited-duration health plan cost an individual about $124 a month. Now, that's a lot of money for a lot of Americans. But it's much better when you consider that if you compare it to an unsubsidized Obamacare plan, it costs $393 a month. So you could save 70% by buying a short-term, limited-duration health plan. Again, the problem was that under the Obamacare, you could only buy one of these short-term plans for 3 months. Now you can buy them for much, much longer. Now, the self-styled betters of Washington, B-E-T-T-E-R-S, of Washington, D.C., the cultured cosmopolitan crowd up here, who think they know better than everybody else in America, who think they're smarter than all Americans, would do away with short-term, limited-duration health plans if they could. Because they think that, well, the American people, they're not smart enough to understand what they're buying. So we're not going to give them the choice. We're smarter than they are. They need to look to us here in Washington, D.C. to run their lives. And we saw that effort yesterday on the floor of the Senate. Fortunately, we defeated it. The American people are plenty smart. Now, they may not have time to read Aristotle every day because they're too busy earning a living. But they get it. They've watched their health insurance premiums rise through the roof as a result of the Affordable Care Act. And many of them have sought out this alternative of short-term, limited-duration plans and say, hey, we know it doesn't cover as much as some policies, but it's a heck of a lot cheaper, and we'd like to buy it and try it for a while. And as Americans, they're entitled to do that. And I'm pleased that we could reserve the option for them, Mr. President. It was a win for American families in my book. We're not giving up on replacing the Affordable Care Act. Again, it gives me no joy to say that we have to replace it, but it just hadn't worked. And any fair-minded person who's at all objective would have to look at a plan that promised us cheaper policies and more accessibility and ended up with more expensive policies and less accessibility and say it just didn't work. And we've got to replace it, and we're going to keep working on it. But in the meantime, Mr. President, I wanted to point out to my colleagues that we continue to chip away at the rising cost of health insurance in America. Thank you, Mr. President, and with that, I suggest the absence of a quorum.